Hello, everybody. Welcome back to the Beat Podcast. I am so excited to be with you all today because we have our annual visit with Mary Varghese Presti. She is the Corporate Vice President of Microsoft Health and Life Sciences. Just an extraordinary leader. I'm just privileged to have the chance to chat with her every year. Mary, welcome to the podcast again.
Thank you. This is our meet cute. It's such a delight to speak with you.
It definitely always is. I want to kick us off by you had a keynote. Tell us about that keynote. I just want everybody listening to know about it.
Sure. Microsoft published this report this year, and we really think about 2025 as the year the frontier was born, the frontier firm was born. But I think that there's a lot of jargon around AI and frontier. And when it comes to healthcare, the keynote was really focused on what is the AI frontier in healthcare. And so I really wanted to break that down and make it very real in terms of what it means and what's actually happening today for clinicians, so physicians and nurses, but ultimately what that means for patients. And it was a very personal talk because I actually came to the United States because my mom's recruited as a nurse from India during the workforce shortage in the 70s. And so I actually showed a picture of her. And it's really my story of becoming American as well. So I have a lot connected to the fact that we had these workforce shortages. But also in this era of AI, we don't have the capacity to move human beings across the globe anymore because the workforce shortage is everywhere. And so not only are we at this very exciting era of AI, but we're also looking at by 2030 a shortage of around 11 million workers for the healthcare demand and the aging population. That's not like decades away. That's 5 years away.
It's crazy.
And then I talked about my own time as a nurse, and that's a different era because it was pre-EHR. And then I really talked about what it means to be a nurse today, but also physicians and also what it means for us as patients. But really deconstructing AI and this journey of becoming frontier, which is what most people really know today is the assistant. The AI assistant at Microsoft, we call it Copilot. But really, the future and there are areas of the present today is around agentic services. And the future is this hybrid workforce where you have human colleagues and digital colleagues, where the agents are actually independently doing work. And if you can imagine a world, what that looks like in healthcare, that's basically what the essence of my keynote was.
That's literally like a needed resource, and I love it. For those of you that didn't get a chance to watch it, or maybe you want to hit repeat, like a good Netflix series, go to the health community. It'll be posted in there. And in fact, I'll make sure that the team links it up in the show notes so you have quick access to Mary's keynote. Definitely inspiring, one you're going to want to check out. And so, Mary, thank you for sharing that, for sharing your very personal experience and the problem, right? The problem's big. And with that comes Dragon Copilot. So help us understand, right? Dragon Copilot for nurses has become an exciting addition to Microsoft Healthcare's portfolio. Take us back to the moment it was born. What sparked its creation, and how have you seen it touch the lives of nurses on the front lines?
Yep. So we've been in this space for a long time with Dragon Medical. And then with the sort of unlock of generative AI, we evolved Dragon Medical to Dragon Copilot, still very focused on physicians. But back during the Dragon Medical days, we really started to hear more and more from our clients, health systems. What do you have for nurses? What do you have for nurses? And this was post-pandemic, where I think collectively we all understood the sacrifice and the real value of our frontline staff, the nurses. And so they're a left behind workforce, honestly. Like there's been very little that's been actually innovated for them. And if you think about nurses, there's 5x the number of nurses as there are physicians. And so as we dug into it more and more, and it was really important for us to dig into it, not just with the nurse executives that were saying to us, what do you have for nurses, but the nurse managers who are managing these units and trying to really navigate burnout and shortages, capacity, more acuity in patients, and then the staff nurses. And once you go looking, I'm very proud of the team. Like we just could not look away. Like there were just so many things, so many gaps. And so we really took an approach of what are the jobs to be done? What is it that the nurse is doing? What are all the different things that's taking the nurse away from patient care? And studies have now proven this out, have been published, but nurses spend more than 25% of their time on a shift. So in a 12-hour period, more than 25% in the EHR documented. So a quarter of time not spent with patients. So that takes a toll because you have to do this documentation, but you're also, as a nurse, you're an advocate for that patient.
Right.
That patient is in your charge for those hours. And so it's a constant drumbeat in your head that when you're documenting, you're not with your patient. You're not available. You're not, maybe the call bell is going off and you're just not there, right? And that is an emotional toll for each of these nurses as well. So we really set out to really solve for that. And this is where like we have a track record in documentation using voice, but nurses document so differently. It's not the same thing. So we had to build something, and we were very
You mean amongst each other? Or
Physicians?
compared to physicians?
Compared to physicians.
Got it.
So physicians document like narrative. You're having a conversation with a patient and there's a SOAP note, the subjective, the observation, like all of these different things, the assessment, the plan. But nurses are documenting like input and output and fluids and vital signs and pain scores. So it's all very flow sheet driven. And so that requires like a sort of a different technological approach, right? AI, for you to just be able to speak out loud observations and have the right data elements show up in the right fields.
Yeah.
And it's also, change management is also key here, because nurses are like, they're very efficient. They're going in, they're clocking 5 million things in that room, right? And so they're clocking that the meal has only been half eaten. They're clocking that the Foley catheter is like half full. They're clocking that it doesn't look like the patient got out of bed yet. But the conversation with the patient is probably like, how's your IV doing? Or so it's a caring out loud now with this solution, because you're coming in and you're really engaging the patient. But it is a little bit of a shift for the nurses to talk out loud now what they're seeing, so that it can just be documented and they don't then have to go document.
Got it. Yeah. Wow. What a nuanced understanding there. And I just have this image of your mom, of you, and this deep understanding of the nurse experience. And it just makes the work that much more meaningful and the end product, right, for the user. So I think that's so great. You've walked alongside health systems and nurse leaders through some deeply human moments. What stories or lessons from those collaborations have stayed with you? Like, how far have they shaped Dragon Copilot into what it is today for nurses?
Yep. We have so many different stories. Right now, we have 10 different pilot partners. We call them private preview partners, 10 different health systems. And what we're finding with these hundreds of nurses that are using the solution today is a nurse thinks that they're going to go in and turn on the recording because they're about to give a medication. And what we're finding is nurses like turn on the recording and forget to turn it off, and realize when they go in to give that medication, they end up staying for much longer because of whatever comes up, right? The patient asks this question or says this or that. And they're really surprised when they come out of the room. They're like, wow, look at all these other things that got documented. And it really makes me think about, there's this initiative going on across a number of different academics and health systems called a blueprint for change for acute and critical care nurses. And what it is seeking to do is really look at all of the things that quote unquote are invisible that nurses do, and trying to figure out how do you quantify that? Because how do you really determine a value of even an hour of a nurse's time? And when I was getting this feedback about what's going on with the use of our solution, it's like this technology is actually capturing a lot of that invisible interactions between a nurse and a patient, right? One example is one of the health systems, a nurse had just come on to the shift and started ambiently recording, and not really recognizing that the nurse before had documented a few things in a particular area. But because it's real time, right? I'm speaking to you and the solution is ambiently recording it and then filing it. The neurologist saw a pattern from the last shift to just that very first observation of that nurse in that first hour and actually took an action on it. And so the pattern detection that's possible because the inputs are so much more higher volume and yet not burdensome to the nurse.
Right.
It's really capturing like so much more context about what's happening during that patient's stay. And I'm really excited about that because I think the knock-on effects of that is that we will uncover over time is quality outcomes, patient outcomes, right? Because we have more information.
Totally. Yeah. And somebody had once told me, Marian, maybe you could gut check this. It's like the nurse's time versus doctor's time tied to CPTs versus not.
Yep.
Is there like an opportunity in doing something about that, or just can you speak to that?
Yeah, so that's why I mentioned this blueprint for change, because I think what that sort of consortium is trying to do is you first have to even identify what are all the different things that the nurse is doing. And then you have to be able to capture it, quantify it, to value it. And so what I love about what they're doing is I think that they're significantly undervalued, not with intentionality.
Sure.
But because with almost every other discipline in healthcare, there's a fee schedule, but there isn't one for nurses.
Right.
And I'm not advocating that nurses need a fee schedule. I'm advocating for making the invisible visible.
Got it.
And let the data speak for itself. Like, how would we quantify the value of all the different things a nurse does in a shift? We first have to see it.
I love that. What an interesting conversation. What do you guys think? Would love to hear some feedback. We do post these episodes on LinkedIn. So let's use this opportunity to get some chat going in the comment section of this episode. Let us know what you think. Mary, so as AI continues to weave itself into the fabric of care, what's your vision for the future of nursing? Specifically, what does it mean for nurses, for patients, for technology to really truly help nurses not just survive, but thrive?
I think the vision is shared by many people at a very high level when we think about what technology can do, right? The difference, though, is the technology is finally caught up to actually have an opportunity to make that happen. And what I mean by that is, I think for all of us, technology was always meant to be in the background. It wasn't ever meant to be the thing. But if you think about what a nurse does all day long today with these workstation on wheels, feels like they're shackled to them, they're pushing them up and down the hallways, and like I said earlier, spending so much time having to document, then that's technology that becomes front and center when the patient should be front and center. So the vision, I think, collectively, that we all appreciate without real detail is a day in the life of any healthcare worker where the technology just is happening in the background. But with today, with where we are with AI and how I mentioned that the frontier is really going from these copilots and assistants to really what I call clinical intelligence on tap, right? So pervasive intelligence. And that happens with agentic services, right? So when you move up from copilots and expand into agents, digital agents, you have this ability because if you think about nurses, they have nobody to delegate to. Who would they delegate to? Like if you think about the physician side, there's an attending, there's a fellow, there's a resident, there's an intern, there's a medical student. And nurses don't have that. And so when I think about agents that are able to take rote, predictable workflows and just do them, right? And they don't even need to be clinical. There's so many things that nurses are doing that are not clinical. You get an admission, you got to make sure that the right kind of meal is being ordered. You got to make sure if there's a latex allergy that there's a sign on the door. Like there's all of these different things. And a lot of times the nurse is like negotiating with other ancillary departments. Like, no, I really need that transfusion. I really need that blood here, like within the hour. Like it's just so much of that. If you can take a big chunk of that and have agents do that, and then you have this vision of technology is working behind the scenes, but what it really does is it restores the humanity back to the individuals in that interaction in healthcare.
Yeah, it really does. And how far along are we with agents, Mary? Like there's talks like, hey, you could book your own flight and things like that. Like, is that all happening now?
It is happening. I said this in my keynote. Imagine knowing every single thing you know today, everything that you know today, right before the internet changed everything. That's where we are, right? So there were some people who were a little bit ahead and doing things, and there are the rest of us who are like, what is this online banking? I'm never putting my information on the internet, right? And it happened, right? We all do it now. Like Venmo, Zelle, like it's just a part of our life now.
It's ubiquitous, and we all do it.
Yeah. So I think that is going to happen with AI. It's just the moment that we're in. So, but to answer your question very specifically, it is happening. There are health systems that have agentic workflows. Again, we're starting with the very predictable workflows, an agent that looks up stuff and serves it up for you repeatedly.
And if I could, because a lot of there's also, I don't know if it's a gray area or confusion between robotic process automation and agentic.
Yep. I think it's one is true automation, right? But agentic services is more than automation. It's reasoning.
Got it.
Right? It's able to actually, it's able to pull out the relevant things and surface it. So a very specific example that's happening today is Stanford Medicine. Mm-hmm. They've actually, through agentic services, really accelerated. Do you know what a tumor board is? When you're diagnosed with cancer, you have all these different specialists that come together, review a ton of data to determine what the course of treatment is. Yes. So that collective is called a tumor board. Mm-hmm. And so what Stanford Medicine has done is they have a number of agents that actually cull through all of the scans, the images, the clinical notes, the lab results. They pull all of that up. The specialists all get together on a Teams call. All of the right information has already been dug up, the relevant information for this diagnosis, for this patient. Pull it all up summary-wise. So the specialists are on this Teams call, and they're able to get to the course of treatment in days. This typically takes several weeks, if not months.
Got it.
And it's several weeks, if not months, of a patient that has just been told they have cancer. And it's all this time it's taking to figure out what they're going to do about it.
Got it.
So these are agents that are working today, right? So this is an example, like to go through thousands of pages or screens of your medical record and pull out very specific things. The amount of time it would take a human to do that versus an agent. That's the example.
Love that. Thanks for making it concrete for us, Mary. Look, I always enjoy chatting with you. So great to see you again and to be with you. And folks, Mary always comes with the latest insights, especially for nurses in the space. So big shout out to all our amazing nurses out there, right?
Heartbeat of healthcare.
That's right. So look, I just want to thank you all for tuning in on this episode with Mary Varghese Presti. She's a corporate vice president of Microsoft Health and Life Sciences. Everything's going to be in the show notes, so make sure you check those out for the latest. And Mary, thanks so much for joining us again.
Thank you, Saul.